Hi, hello, welcome back. So today's topic which we are going to discuss is coronary artery anomalies, the code series 33500 hyphen 333507. So this is a topic which is coming under cardiovascular part of CPT part. So we will be having a clear discussion about this topic along with examples and so to start with the topic, understanding the CPT codes related to coronary artery anomalies 33500 to 33507 is essential for accurate medical coding. These codes pertain to the surgical repair of coronary artery anomalies, which are abnormal coronary artery structures present from the birth. So here is a comprehensive breakdown of the codes along with definition, example, description, tips and conclusion. Introduction to coronary artery anomalies 33500 to 33507. These codes cover various surgical procedures aimed at correcting congenital coronary artery anomalies. These anomalies can lead to compromised blood flow to the heart muscle and may require surgical intervention to restore normal functions. Next comes the definition. Coronary artery anomalies, abnormalities in the coronary arteries that are present at the time of birth. These can include anomalous origin, abnormal connection or abnormal parts of the coronary arteries. Anomalous origin, the coronary artery originates from an unusual location. Abnormal connection, the coronary artery connects to an unusual location such as another coronary artery of the chamber or the heart. Examples for this is code 33500, repair of coronary artery fistula with or without patch. Here the surgical repair of abnormal connection fistula between coronary artery and heart chamber or another blood vessel with or without use of a patch. So that is a description of this code. Second example 33501, repair of anomalous coronary artery origin with or without graft. Here the question will be reimplantation of anomalous left coronary artery originating from the pulmonary artery into the aorta. So the description of the code 33501 is surgical correction of coronary artery that originates from an abnormal location with or without the use of graft. Next is 33502, coronary artery bypass graft, single arterial graft. Here the bypass of single coronary artery is done using the arterial graft. So the question can be asked as CABG using left internal mammary artery to bypass a blocked left anterior descending artery. Question can be asked in this way. And next is if they are asking you a question, CABG using the left and right internal mammary arteries to bypass blockages in the left anterior descending and right coronary arteries. For this we will be coding 33503, coronary artery bypass graft, two arterial grafts. Here bypass of two coronary arteries are done using arterial graft. Next one is next example, CABG using left internal mammary artery and radial artery to bypass blockages in three coronary arteries. For this we will be giving 33504, bypass of three coronary artery using arterial graft. Next example for this is 99305. The question will be CABG using left internal mammary artery using both radial arteries to bypass blockages in four coronary arteries. For this we are giving 33505. Description of this code is bypass of four coronary artery using arterial graft. Next is 33506. Here the coronary artery bypass graft is done. So the question will be CABG using left internal mammary artery, both radial artery and another arterial graft to bypass blockages in five coronary arteries. So here we are giving 33506, bypass of five coronary artery using arterial graft. Next is 33507, repair of coronary artery aneurysm. Here repair of an aneurysm in the left anterior descending artery is done. The description of this code is surgical repair of coronary artery aneurysm, which is an abnormal bulge in the wall of the coronary artery. So the tips for coding this is, first we have to understand the specific coronary artery anomaly and the surgical approach used and whether any graft or patch has been applied. So these are the points which you should be very clear when coding this. That is whether you should know that coronary artery, what type of coronary artery anomaly is that, whether any surgical approach is used and whether any graft or patches has been applied, and please check what modifiers will be appended to this question. So that's all about this procedure. So we are concluding it by CPT code 33500 to 33507 is crucial in accurate coding in cardiology. These codes cover a range of procedures aimed at repairing congenital coronary artery anomalies and restoring normal blood flow to the heart. Accurate documentation and clear understanding is very much essential for correct coding. So that's all about this topic. Thank you so much for watching. If you haven't subscribed, please do subscribe, and if you find it useful, please do share it with your friends also. So thank you so much for watching my video. Take care. Bye bye.